I'm Mary Willis, and I'm an assistant professor over in the Department of Epidemiology on the other campus. And so today I'm going to talk to you about a few of our different projects related to oil and gas development. In the US, about 17.6 million Americans live within 1.6 kilometers or 1 mile of an active oil or gas development site. That's about 5% of the US population. And you can see from this map that we cover a pretty wide geography with where these sites are located. And many of these communities are pretty darn worried. And so when we start thinking about this industry and we start talking to communities, there's kind of three domains in which their concerns fall. Right off the bat, there's these environmental exposures. Oil and gas development produces air pollution, such as incomplete combustion byproducts and pollution from the site itself. Water contamination, potentially from drilling straight through the water table. Persistent light and noise from around the clock activity. And generally, there's a few other concerns that pop up, but those are the biggest ones. When I started working on this, I was exclusively stuck on looking at this from an environmental perspective. However, at the same time, when this industry comes to town, there are massive social changes in these communities from an influx of new workers, as well as a pretty substantial set of economic concerns, such as there's increased wages, which is great, but not for everyone, as well as cycles of boom and bust economies. And so we think from this, depending on which set of exposures your community receives, it probably has different impacts on population health. And so the main project that I've been working on these days is the first prospective cohort study of oil and gas development and reproductive health. We use data from Pregnancy Study Online, an online preconception cohort study of couples attempting pregnancy. We have about 21,000 participants across the US and Canada, representing at least one participant in every state and every Canadian province. Within this project, we've spent a lot of time to date on exposure characterization. We now have a highly spatially and temporally resolved database of every oil and gas extraction site in the US and Canada. We're also looking at risk perceptions, how worried are people about this industry, as well as launching a personal monitoring campaign with some participants. And then we're going to look at this cascade of reproductive events that most of which represent things that communities are pretty worried about. But at the same time, I found this to be not the greatest, not the most comprehensive way to look at this industry. And so we've recently started working out how can we look at cycles of boom and bust economies that may affect community mental health. Some of these communities are experiencing booms of economic benefits and bust again and again and again. And we don't really know how it affects these places in the long run. And I will leave it there.